Good morning, good afternoon, and good evening. Welcome to the 466th day of continuous Zoom session of Ifph. Let us start our program with a silent prayer for a minute. Thank you. Leading from front is the real quality of a winner or a captain. That is what our today's guest is doing. He is also coordinating all these functions with hundredfold vexations and problems. He always leading with and giving some examples. It's an important topic today. Our presentation is breast cancer and homeopathy evidence based. We all know that's a very difficult tough act to follow. But Dhanesh, your doctor, is an expert on not only in the conducting this program but also as a physician. You all know that. So on behalf of IFPH, I am once again welcoming Dr. Dhanesh. He's the member at faculty cell of IHK, convener, Animanian Study Circle Chairperson for 36 years of experience. Once again, I am welcoming Dr. Dhanesh. You can have a platform for the next 40 minutes. Over to you, Dr. Dhanesh.
Thank you, Dr. Manoj. And good evening and good afternoon and good morning to those who are joining from different part of the world and different part of the India. And I'm very happy to be back with a webinar session in this evening. And today, as you all know, one of the subject I chosen is none other than breast cancer. Even though I was not prepared to present the paper tonight, but due to the inability, due to the lack of faculty who has some problem with his sore throat, and his webinar was postponed to next week. So I just come up with a quick alternative or some just like a sort of job gap arrangement. I just joined this as a session to take you to the next 1 hour. And as you know, I have presented so many papers in this forum in a different style, but this time I would like to share some of the case from this, and I shall try to bring that. First, let me share my screen now. Let us see how it goes. Can you see?
Yes, of course.
So let us go back to our session directly. And as it is, and the subject is breast cancer and homeopathy. As you know, breast cancer is one of the leading disease that happens in all over the world. Nearly 1 million people suffer from breast cancer every year. So that much intensity of this disease. This is the second largest, second the number of cancer that is leading in female cases. So we need to look into that in a different way. As we know that breast, as you know, it is the organ that produces milk for the next generation. So we have to keep the breast in a beautiful way or in a healthy way, so that we will be able to give the breastfeeding to the next generation in a good way. And as you know, breast milk is the best solution for the healthy well-being of your child. And this is what we think about this breast milk. And so breast is the most important organ in the body as far as a woman is concerned. This really transmit what from the mother to the child, as well as it is the one thing that really makes the most beautiful women most beautiful, because it is a bilateral one. As you know, if there is a problem on the one side, definitely the other side will be having a problem. So this is one thing that we have to think in. We have to think of these breasts in different style. As you know, breast or a mammary gland, which is multiple glands. It is a group of simply not a single gland, but it is a group of glands collected together to produce, and it has some different things. As you know, then that is one thing is there is lobules in it, then duct in it, then lot of connective tissues. So these are the things together comprises of this breast. The milk is being produced in the lobules, and from there the milk is being transmitted to the nipple via duct, and the connective tissues really give the shape and size to the organ, which really protect the breast from the lobules from external injury and all these things. So these are the things you have to understand. So naturally, what about the cancer? That where are the part, which are the part really the cancer affect? As you know, the cancer really affect on the lobules first, or duct, or sometimes on the connective tissue, but most probably it may be an invasive disease that affect the lobules first, or sometimes on the invasive disease as the other part, that is the duct or the lobule, but maybe, and sometimes it may affect in the connective tissue also, sometimes in all part. So once these cancer affect in this sense, definitely there is a group of increased growth of cells in that area, and that will definitely prevent the production of milk, and definitely that will lead into problem for the child. So if you look at the breast in a different style, if you look at the anterior part, that the front part of the breast is look like this, on the side. This is the breast first. There you can see the muscles, you can see the lobules here, and you can see the nipple here. Then the areola, which is around the nipple, and then there is a fat tissue in between, around, and these are the duct that takes away the milk. And this is the lateral view of this breast. If you look at the same, you can see a beautiful way of the presentation. Everything is there in this area, and from there the nipple, it comes to this areola side, that is at the black, here you can see a little bit black here, and to that area it may come as milk, and this is what happens with the milk production. As you know, when a girl develop into when a girl matures into a woman, that is then we call as from the menarche to menopause. This is the time then you have to see the changes in, most probably in girls and women, where usually the breast cancer affect, and usually the breast cancer that comes in this period, and the most common age between are about 30 years of age, and or sometimes it may affect after 50 years. That these are the time then something, some of the changes usually happens in women. As you know, at about 50, that is a menopausal age. What happens is the hormones functions vary. Some hormones need to be stopped, and some are need. Those changes also makes things worse. But as far as the theology, why this cancer of breast happens, this is something we cannot even explain. But in a textbook, it may be saying that it may be due to some hormonal changes, or it may be due to the some technical problem in the breast of the physician. But actually, as a homeopath, what I found is entirely different story. What I found is, yeah, that in almost all cases I have treated with the breast cancer, there is a mental trauma that is one of the most important cause for this breast cancer, and that I have noted in those conditions. So I will come to that in the while presenting the cases of breast cancer. So let us go back to the next part of this session. You see, what are the changes happening is there may be the skin changes, including thickening or dimping, and changes in the color and indicate the breast cancer. And then red spots in the breast. Red spots on the breast can indicate mastitis, but it can be a sign of inflammatory breast cancer. But then say unusual or a new breast shape. So usually breasts have a symmetrical shape, but in some cases it may have a different shape. You can see the right and left may be a little bit different, and that may be an indication of a breast cancer. So another is, if you look at this case here, the inverted nipple, that is also one of the reason, one of the indicator for breast cancer. The flat and sometimes the breast may be a little bit flat or an inverted nipple at the nipple that point to the difficult direction than the earlier. It may be the sign of a breast cancer. These are some of the signs of the breast cancer. And you see skin changes in the nipple and an early indication of breast cancer. This is an early indication that there may be little bit of changes. The breast cancer may be include inflammation, scaling, thickening of the nipples like that. Unusual nipple discharge. This is one of the thing I have noted in almost all cases. It is not common to experience unusual discharge, especially when the baby, when the bloody or pink or from the breast. Consult your doctor. There is sometimes this is what usually bring patients to us. Of course, there it is maybe a sensation of the lump. That is one of the not only sensation but feeling of a lump that really take women hurry rush to the doctor, and sometimes they may direct for mammography and everything, and then it may be detected as a breast cancer or so. So that these are the things to be noted here. Then lesser known symptoms to watch while breast lump may be a telltale sign of breast cancer. Here are some of the, let us not go on that details, but of course these are some of the point that I would like to add to that. But what I have found is that these the number one cause is none other than the clashes in the family, or the clash in mental trauma or physical trauma, or maybe the lack of support, or maybe the psychologist. So almost what I must say that the melancholic persons usually get this disease rather than those or choleric or some other person. So these are the things I would like to add to this presentation. So let us see one video where a patient, I was able to cure a cancer case, but the patient is still living. So let us hear what this lady, who is the daughter of a breast cancer patient. So see what she, let us wait and see what she has to tell. I will translate into English. വീട്ടിലെ നമ്മുടെ അമ്മയുടെ അസുഖങ്ങളെ കുറിച്ചൊക്കെ ഒന്ന് പറയാമോ? ഹോമിയോപ്പതി ട്രീറ്റ്മെന്റിനെ കുറിച്ച്. അമ്മയ്ക്ക് ഒരു 8 വർഷമായി ബ്രസ്റ്റ് ക്യാൻസറിന്റെ ഇത് തുടങ്ങിയിട്ട്. അപ്പൊ അന്ന് ഭയങ്കര ബുദ്ധിമുട്ടായിരുന്നു. Her mother was having breast cancer for the last 8 years. അല്ല അന്ന് നല്ല തടിപ്പുണ്ടായിരുന്നല്ലോ. വലത്തെ ബ്രസ്റ്റിലായിരുന്നു. There was a little bit lump on the right breast. There was a blood was oozing from the nipple and discharges. That was coming for about some 5 to 6 months, and now everything is 5 to 6 months. It stopped and her breast became normal. During that period, she and her family members really suffered a lot because of the stress due to this disease. Everybody wants to take these people to their home. By about 7 to 8 months, her disease was totally controlled. This patient later developed a little bit of hypertension, and then only some cramp-like symptoms, some just showing signs of stroke, but she was fully saved by homeopathic medicine at that time. ഇങ്ങനെയുള്ള അസുഖങ്ങൾക്ക് ഹോമിയോപ്പതി നല്ല ഫലപ്രദമാണെന്ന് തന്നെയല്ലേ നമ്മുടെ അഭിപ്രായം? കാരണം ഇപ്പൊ ഇംഗ്ലീഷിലോട്ട് നമ്മൾ പോയി കഴിഞ്ഞാൽ ബ്രസ്റ്റ് എടുക്കേണ്ടി വരും. അതിൽ എന്റെ ഒരു അനുഭവം വെച്ച് എനിക്കറിയാവുന്ന 2-3 ക്യാൻസർ
പേഷ്യൻ്റ് ഉണ്ട്. പക്ഷെ അവരെല്ലാം മരിച്ചു. എൻ്റെ അമ്മയ്ക്ക് അസുഖം വന്നു കഴിഞ്ഞാൽ അവർക്ക് അസുഖം വരും.
What she was telling is that
ചെറുപ്പമായിരുന്നു അവർ എല്ലാവരും. ഒരു പുഷ്പ ടീച്ചർ ശ്രീജുകുളങ്ങര സ്കൂളിലെ പുഷ്പ ടീച്ചർ, പിന്നെ നമ്മുടെ വിദ്യാലയ പറയുന്ന വിഷയം എന്ന് പറയുന്നത് ഇവരൊക്കെ ശരിക്കും ഏജ് അമ്മയിലും കിടക്കുമായിരുന്നു. 50 വയസ്സിൽ താഴെയായിരുന്നു. പക്ഷെ അവരുടെ ഒരു ഡെത്ത് കണ്ടപ്പോൾ ശരിക്കും എനിക്ക് ഞാൻ എൻ്റെ മനസ്സിൽ ഓർത്ത കാര്യമാണ്. അവർ ശരിക്കും ഇംഗ്ലീഷിലോട്ട് പോകാതെ ഒരു ഹോമിയോ ട്രീറ്റ്മെന്റ് അവർ തുടർന്നിട്ടിരുന്നെങ്കിൽ ഒരു പക്ഷെ അവർക്ക് ആ മരണം പെട്ടെന്ന് വരത്തില്ലായിരുന്നു. കാരണം അതിൽ എനിക്ക് അത്രയ്ക്ക് വിശ്വാസമുണ്ട്. കാരണം അമ്മയുടെ സ്റ്റേജ് ഞാൻ കണ്ടത് കൊണ്ടാണ്. അതുകൊണ്ട് ഞാനത് ഇപ്പോഴും മിക്കവരോട് അറിയാവുന്നവരോട് ഞാൻ പറയുന്നുണ്ട്. പിന്നെ വേറൊരു ഇതെന്ന് പറഞ്ഞാൽ ഏതൊരു മെഡിസിനും നമ്മൾ കഴിക്കുമ്പോൾ നമുക്കൊരു വിശ്വാസം ഉണ്ടായിരിക്കണം. അത് മസ്റ്റാണ്. ഏത് മെഡിസിൻ ആണെങ്കിലും.
What she was telling us that her mother was saved in a beautiful way, because even though she was above 70 years of age, the person was saved. But those people who are younger than her age, that is some people around the area who are having just above 50, who opted for allopathic treatment, were no more in the world. And this is what is the mastectomy, total mastectomy was done. But even though they could not be saved by that system of medicine, but here homeopathy saved her mother, and she is still alive even after the age of 80, and she is still living. This is what is the beauty of homeopathy. This is what she is telling. She was so much depressed, but she has advised some of the local people to take homeopathy for breast cancer, but unfortunately they rushed to the allopathic medical college, and where they end up with the last right. And this is what is happening with the other system. But frankly speaking, homeopathy, if you have the proper weight, and you have the time to understand what is homeopathy working, what is the principle behind homeopathy treatment, definitely you can save the people from this disaster of death, or that what she was telling. Let us see what is her conclusion.
ആ വിശ്വാസത്തിൽ കൂടി കഴിച്ചു കഴിഞ്ഞാൽ നമുക്കത് അതിൻ്റെതായ അതാകുമ്പോൾ കൃഷ്ണൻ അതുപോലെ ശരിക്കും അതുപോലെ എന്നെ സംബന്ധിച്ച് ഇതിലൂടെ പറയുമ്പോൾ ഒരു ഹോസ്പിറ്റലിൽ കൊണ്ട് അമ്മയെ അഡ്മിറ്റ് ആക്കേണ്ടി വന്നില്ല. അതാണ് എന്റെ ഒരു സിറ്റുവേഷൻ വെച്ച് നോക്കിയിട്ട് ഞാൻ ഒറ്റയ്ക്കാണ്. അപ്പോഴത്തേക്ക് അമ്മയെ ഒരു
അച്ഛന്റെ മരണശേഷി ഇത്രയും വർഷമായിട്ട് നമ്മൾക്ക് അമ്മേനെ ആശുപത്രിയിൽ അഡ്മിറ്റ് ചെയ്തിട്ടുണ്ട്.
According to her, what is the most advantage of her life was that this patient was never taken to a hospital even till now. This is what is as far as their family is concerned. They are coming from a very poor family, and there were only three people. One, this lady is the youngest, the eldest one, and the second one got married, but he is not in a good relation with this family. The other one is also, the youngest one is also not in a good position. So the family find it may be a very difficult task for them to take this patient to medical college, and so, but fortunately homeopathy saved them in a beautiful way. This is what she was telling.
അമ്മയ്ക്കും അത് മാനസിക സംഘർഷം ഉണ്ടാക്കും, എനിക്കും മാനസിക ആ ഒരു അവസ്ഥയിൽ വന്നില്ല.
നമുക്കൊരു വലിയ കാര്യമാണ് ഹോമിയോപ്പതി.
എന്റെ ഇതിൽ പറഞ്ഞു കഴിഞ്ഞാൽ ഹോമിയോ നമ്മള് അല്പം ക്ഷമയോട് കഴിക്കണം. പിന്നെ അതിനുള്ള ഇതെന്ന് പറയുന്നത് ആ കറക്റ്റ് ടൈമിൽ കഴിക്കണം. അരമണിക്കൂർ ഇടവിട്ട് മെഡിസിൻ കഴിക്കണമെന്ന് ഡോക്ടർ നിർദ്ദേശിച്ച അരമണിക്കൂർ ഇടവിട്ട് തന്നെ കഴിച്ചിരിക്കണം. അത് നമ്മുടെ ഇഷ്ടത്തിന് 1 മണിക്കൂർ ആകുമ്പോൾ ചിലപ്പോൾ ഉദ്ദേശിക്കുന്ന ഫലം കിട്ടുന്നത്.
തീർച്ചയായും വളരെ സന്തോഷം കാര്യങ്ങളൊക്കെ ഡോക്ടർ പറഞ്ഞിട്ടുണ്ട്.
This is what she was telling, that if you take homeopathic medicine, you should take the medicine in time as per the direction. If you believe in the system in that way, definitely, if you follow the system in that way, definitely you will be a winner with homeopathy. You can cure any case by that way. So this is one of the greatest achievement of homeopathy, not only for me but to the system itself. I dedicate this to our master Dr. Hahnemann and his followers. Because of those people, I was able to study homeopathy, and I was able to deliver such a thing in a beautiful way. I must say it is a gift of the God. Definitely that works in me. And thank you that I thanks this person for her for coming and giving such a video for me to promoting homeopathy. She's working hard to promote homeopathy. So let us see how this really gives me the confidence to treat those cases that are coming with the discharges. As you know, the in breast cancer, usually people have a problem in the nipple, and there it may be dry up. But sometimes there may be a little bit of crack inside. There may be sometimes it may be grow inwards like that. The nipple may be in a different shape also. The size may be different, everything may be different, so the patient will be in agony what to do. Everybody know that if they go to medical college, definitely they will cut off the breast, and they will say that, oh, you are saved from the cancer. But unfortunately they are not saving. Only very few, only I must say 10% of people are really surviving after this kind of treatment. So let's just go back to another case. Thank you once again all for your patient listening. This is another case. So I will. I got confidence of treating this kind of treatment after this presentation. You see, this is a cancer, but typical breast cancer case that that lady. Let me say a few words before that. This patient was one of my patients some 30 years back, where when usually there was a cystic swelling on her breast, and she visited me at my clinic, and I was able to cure within some 5 to 6 months in those area, those time. And and even before 1 year, she stopped medicine because there is no need for taking medicine. Let us. She was having three children, and all of them matured, and some all of the children were married, and they got children. She's become grandmother now, and her husband was so caring, and said they are leading a very joyful life till his very some 3 to 5 years back he died of some disease. That really affect this woman, and thereafter she feels some pain and little bit of a problem in the breast. And in between, when I inquired about the family problems, there was a little bit of problems in the family also. That really wasn't the condition. So this is the mind. This is the problem with the people, because when the mind is deranged, definitely there is a possibility of a villain coming into the body to invade. This is nothing but cancer. Cancer can come at any time in anybody, because the cancer cells are in with all of you, all of me, all of us. I must say, all of us. There is cancer cells, but in a favorable condition, only it comes out. Otherwise, it may be there as a silent watcher, just like our germs. They're doing good thing in for trillions of germs are doing good things to our body, just like cancer cells also there, but they won't do any harm till a favorable condition rises in the body. But how the favorable condition comes, that is the question, and that homeopathic doctor need to look into. I must say, what are the causes here? Is the mental stress, mental worry, mental trauma. All this, these are the findings that I must add. This is the unknown. Usually, the allopathic people used to say this is an unknown etiology, but it is not at all an unknown etiology. But we have the etiology here. It is none other than these mental stress, mental trauma, and mental all these things. So this was the this is how this lady on her consultation on the first visit, you can see. So naturally, after taking homeopathic medicine, you can see the changes happening one by one after 1 month, 2 months, like that. You see, these are the, you see the areola getting darker, and the scales become thicker and thicker, and it is about to burst. This is by about the third week. So this is something that really changed with homeopathic medicine. So So after taking that, after some more time, what really happened was, you can see within 1.5 months, another change. This is the change that really works on here. What you can see, it ruptured. It is about to rupture. Here it is about to rupture, but here it is ruptured. And so this is what I must say, that homeopathic surgery without touching the body with a scalpel. This is the beauty of homeopathic medicine. We can do homeopathic surgery without scalpel and without touching the patient. So I am not doing any. This is only the patient is doing everything on her body. And now see the crash. Actually, this picture was just some 1 month back, but unfortunately, by editing it may change into the other side also. You see thereafter another change, the scale, the complete areola has removed from that area even without a scalpel. This is another change that happens with the cancer of the breast cancer. So now let us go to, then it becomes deeper and deeper. You see, you can see the scales are coming out, but the patient, though there is pain, but they can afford the pain. That is the most important aspect as far as the homeopathic treatment is concerned. Patient can afford the pain because of the treatment. We can control the pain also. So this is the other side. So see the changes. This is, I must say, this is the last picture I got, but in between, you can see the changes happening there. It become flat and everything. Almost all the damage thing were removed. Only slight discharge was coming out in the last consultation, but the patient is feeling better. She is having HB of about 12.5 or so. So even this is what we have to look into, whether if it is a, if the case is worsening, definitely there will be severe damage. But you see, only ESR is 40%, 40. There is 40, ESR is 40, but still HB is 12 point something, and that is how homeopathy can manage. So without, she is having full of her hair, she is having very good sleep, she is working at her home, she is even doing homely work, and she is even cooking, used to do cooking, all these things. There is nothing like that. The only thing is that if somebody comes and she shows, then only then they will also become much they may cry out of it after seeing, but the patient, as far as the patient is concerned, patient is not bothered about this. That is the difference between homeopathic treatment and the allopathic mode of treatment. So the patient is improving very much. I hope within some 2 to 3 months, she will be the good scale, the breast will totally cured, and she will have a beautiful breast in the coming days. So this is the second case I want to share here. So let me go to another case. Here the patient is having a big lump on the right breast, and so there's some little bit of small lump on the left side, and she was taken whole body. If the PET CT scan was done, and the patient was taken to medical college and everything, and they was about to remove the breast because it is spreading like anything. You can see all the records here, and it was diagnosed. It was diagnosed as invasive carcinoma of breast, provisional grade 2. And after taking biopsy, it was taken. But one thing I would like to add here, the patient was just having a lump only in the beginning. But what happened was, after taking the FNAC, the lump become painful and it grows very quickly. That is one of the things that you have to think, whether you have to go for diagnosis, whether you have to go for diagnosis or not. It's not the question as far as we are concerned. We need not to confirm whether it's a case of cancer. For what purpose we need to say that it is a cancer? It is absolutely ridiculous, I must say. But what you are doing is just taking an FNAC from the patient herself told me that, doctor, before this test, I was my breast, was having only very little pain, and it was just like a small lump. But after taking the FNAC, it really grows daily, day by day. The growth rate is very high, and I am getting pain and severe pain day by day. I won't be able to sleep because of that. I was worried about this, and I could not even sleep for so many days. So many nights I was simply walking around because there is a heavy pain all over my body, and it is rushing like a very hot. My body is feeling hot because she is having 47 years of old. That means she is at the menopausal age. So naturally there will be hot flashes in her body. But let us see the etiology. What may be the cause for our disease? This is what we have to look into. When I search for that, what I got the clue. Then when I inquired about the bedroom affairs, then I asked where you people are lying together or not. She told me, doctor, we are not lying together. Why? Doctor, there is no door at your at our bedroom, or not even a door in my home. So you may be surprised. What may be the reason for that? Of course, there is a reason. The younger brother of this her husband so he's a psychotic patient, and he used to destroy all these doors and everything. So there is no doors in the home, and this is what. Then you can imagine what a terrible night in the home. Usually these are the things that really brings out cancer, because she has only one child. She is a girl. She is studying her degree, first second year, and so naturally she need to take care of her rather than lying with her husband. So they are living in a separate room. They are living in separate room because they are every night she cannot even sleep because she is afraid of the other person. Sometimes he may rush into the room and maybe damaging more and more things. So that is the problem with the person who is living. When a psychiatric patient is there in the home, definitely the people around the home also have some problem, and that is the reason for this. She was from a very poor family. She was coming from a her childhood was very low income. She was coming from a low income group, but gradually after marriage she got the comfort. She believed that everything will be settled after comfort because she was married to a good family. But unfortunately, when she reached there, everything was turned around, turned just like what unexpected things happens in the home. Her mother-in-law was also having a psychiatric problem, so there she has to care everything, and she has to do a lot of works, and but she has no time to take care of her, and that may be one of the thing. And naturally her daughter matured enough to a woman, and now the mother is more worried than these are the things that really the conflicts that is going on in her mind that brings out this cancer. And do you know what happened after? It's a very recent case. I just present for the purpose of presenting this paper here, because I want to say that cause is more important than the disease. So that is the reason why I bring out the case, and she is improving nowadays. She is getting sleep well after taking homeopathic medicine. The lump is a little bit, even though there is pain, but it has reduced a little bit, and of course, the size is also not growing much nowadays. So these are the things that I want to say, but I will come up with the case in the later part of sometime next year also if I get the final conclusion of the case. So these are the cases I would like to share. So let me come back to one more cases to your present. This is still, these two cases are still under treatment. So we cannot say about the conclusion, but things are going in the right way. That's what I want to say. Of course, we can discuss about the other thing in the later part of the session if we time allows. This was a mammography report. The right breast mass axillary lymph node will be the category 5 for suggestive of malignancy. Left breast as a benign fibroadenoma, whereas category 2. This was a mammography report. So thank you for once again. Then let's go by the last case of this session. And this is a case of one of my relative also. And she was suffering from breast cancer, but there was a severe, when it was detected, there was severe metastasis. So no surgery or no treatment can be done by allopathic people. So naturally, I have to take care of this mother. And so you can see these are the things to be noted. These are just like warts. There are a lot of warts in the breast. You can see the shape of the bank is shrunken, cracked, and everything. This is a typical cancer breast. You can identify. She has having metastasis everywhere, the stomach, limbs, lungs, and even the bones also. But frankly speaking, she was never taken to any other hospital till her death for about some 2 years of treatment with the homeopathy. She has taken the morning breakfast even just before death. So that is the beauty of homeopathy, and that really everybody can find a simple medicine here with the homeopathy medicine. These are the indicators. Some of the indicators of here, that is the homeopathic medicines that of course you can, everybody can identify what can be the medicine. In this case, you can simply say it is none other than the head remedy, the head remedy, the tuja. As you know, it is one of the best remedy for treating the cancer, because as you know, the cancer miasm is also coming just like a psychotic miasm, though there may be little bit of differences among them. So these are the cases I would like to share for you tonight, and we will have a medicinal part also if time allows. I will share. Let me say about the first case. And the first case, actually, she was a desperate woman whose her first in this case, there were only very few remedies. In the last case, I used only tulja and some of the simple remedies. No, not much remedy was needed because she was having enormous problem after taking tulja. Tulja 30 was given in the early part of her life, and then later I have to shift to tulja, then tulja varnam, and I have given some other medicine also in that. I don't remember exactly because it is few years back. Exact medicine treatment I just forgot because I didn't refer everything within the short time. Just like presentation. In this case, you know, this case, the third case where the woman who was suffering from this, who was living with the psychiatric patient, actually the medicine given was carcinosin one of, and carcinosin really works in her. So I just continue with the same medicine. I have no more way. I still carcinosin also given, and then calcarea 4/6 along with the another remedy given was hydrosis tincture, as well as the scrophularia tincture also was advised to take. So this is the pattern of treatment for this lady who was having. I would like to give another more in the later part or something. So maybe I think she is more of a Staphysagra like patient. So I have chosen Staphysagra because I must say most of the cancer patients require melancholic remedies because as you know, melancholic remedies, the Pulsagla is number one, then Netromur, then Ignitia, Staphysagra, Silesia, Graphitis, all those remedies are required in some time, as one time or another you need to take in different patients. So that is one thing I would like to share here. Then in the first case, in these cases also, they actually the medicine in the early part I used to give was phosphorus. She was a typical phosphorus lady having a very high, having good height, and she was much concerned about the members of the others in the family, particularly about her daughter and her children. show anxiety about others, were because there was a little problem in the family, because this woman who is a beautiful woman, her daughter is a beautiful woman, and she was married to a person who is in Gulf, but he is a suspicious patient. So actually that there is a big problem in the family, and they are about to divorce now. So naturally this lady cannot tolerate such a thing, because her daughter is a very good great woman, but unfortunately this man is become a psychiatric patient now, and because of his suspicion the family need to be uh, they need to divorce the case, or she is much worried about that. That is the one of the thing that really works on her. So some other remedies are also given, calcarea floor also given, but in this case silicea 6s was given in the early part along with this phosphorus. So that really works for breaking up these cancer cells in this body, and silicea has done the surgical role in a beautiful way, I must say. So that is what about that treatment of that case. So this case was in a different time. I have to use a different medicine also. So you can see the cracked nipple and everything. I have given graphite is one. There is a continuous oozing of this blood discharge from this body. This thing. In this case, in the first case, I begin with treatment with the sepia, because that lady, her husband died some 30 years back, and thereafter she become so indifferent to everything. She is simply talking this and that, and she can, but she is always talk about her business, talk about her work, the family, but everything. Just like she was a loquacious nature. And in the later part, I have to change from sepia to lacuses, and sometimes I have to convert. Later, I found the real medicine here was it is none other than hyoscyamus, because she was such a person who always talk become though religious, but she is always speaking some nonsense at times, and that's how even she may say that doctor, what about your cure like that, then she may say, oh, it is because of my prayers everything gone, like that she may tell. That is the biggest problem as far as the doctor is concerned. So she never agree things also. So that is all about the material medicine I have given, and at times you can think I have used conium in some of the cases. As you know, it is a hard lump pain like that. The area at the time also conium was given. So in some cases I have given Hytulaga. Conium and conium I used to give 1 potency, and Hytulaga I used to give 30 potency, like that. I have some prejudice also in that view. So whenever I go for the mental symptoms, I used to do 1 or 10 and like that. But not a fixed potency for any particular patient. And at times I used to nowadays in the early part of my in this case, the first case, I didn't use any tinctures, because in those times I was a paka classical prescriber like that. But later I found that in pathological advanced cases, we need changes, and that really works wonders for me also. So this
Okay.
is what I would like to share this night, and thank you for
Yes.
personal listening, and thank you all. I hope you all enjoyed in my this
Yes.
presentation.
Yes. Yes. Anyway, the interim arrangement did not, I think. So it's time to go for discussion. Those who would like to participate can go to the participant list and please raise your hand. Would you please close the screen sharing, Manish?
Yes, yes, yes. Please read.
Okay. Oh yeah. I think one thing is important, that what happens to the patient at last. That is more important. Dr. Dhanesh said, yes, the patient has very peacefully led their life and ended in a natural way. It is quite natural that everyone, those who have to go at a time, at another time, that it happened. And what happens as animal, it often describes that often after the allopathy treatment, the patient screams out of the patient, dismissed as cured. That is the condition. The patient screams out of the hospital, dismissed as cured. But that is not happened here. That is advantage of homeopathy. The aphorism, rapid, gentle, permanent. There is a permanence is there, not a complex after another one. That's important. So it's time discussion. Those who would like to participate can go to the participant list and please raise your hand. Yes, Muhammad Saidan from Jordan. Yes, please.
Yes.
Yeah.
Good time for all. I have a question and a comment. The question is, during the treatment, what are the analytes that you are doing to confirm the improvement of the treating patients? Do you use some laboratory tests or imaging tests or something like that? Or you do depend on the symptoms only?
Of course, we need to confirm all these things through by laboratory finding and X-ray or mammography and all those things. But the thing is that those who are coming from poor people, poor family, they don't have money for that. Otherwise, we need to spend money for that. So there is no such thing for like that. But once the patient is cured, then what is the purpose of reconfirming that you are still as a patient? Let the patient live a long life without suffering. That is what Hahnemann has taught. The highest ideal of cure is rapid, gentle, and permanent. And this is what we are expected to do. And we need not to interfere in that way. Once we test and reconfirm that you are having little slight lump is there, but you need to go for treatment like that, then definitely patients feel that, doctor, I am still having cancer. So there may be loss of life, loss of sleep. Thereby we are damaging the sleep. Let them go with their
Sir.
Actually, those who coming from with financial support, definitely they are doing tests. That is why I show test and everything.
Yeah, sir, may I continue?
Yes.
Yeah. As we all know, there is no definite cause to pick it out to say this is causing cancer. It is a multifactorial disease. It has been agreed among the globe. But my question is in a form of a comment. How frequent you find those patients suffering from GI disturbances? Did you notice that those patients of the breast cancer accompanied by GI disturbances such as stomach reflux, a lot of gases in the stomach, on the intestine, constipation, diarrhea, inflammatory bowel disease, irritable bowel syndrome, and other symptoms in the gastrointestinal tract. And at least it is for the last 20 years.
Of course, cancer being a disease which can metastasize anywhere in the body, of course there will be some problem in the gastrointestinal tract also. But if you give the right remedy, definitely the constipation, definitely the heartburn, there is definitely the belching, and everything will be cured with the same medicine. For example, Tuja can do all these things. There is a feeling that there is a lump in the stomach. That is one of the. There is a lump in the abdomen. That is one of the sensation as far as Tuja is concerned.
Okay. Dr. Mr. Muhammad, what is your
okay? Sir, let me continue, sir.
Yes. Please.
The idea is not the metastatic is. Hello. It is not the metastasis. It is not the metastasis from breast cancer to other parts of the body. It's the initiation of the cancer in the breast as a result of GI disturbances. Did you notice that? It is 20 years before 20 years or 10 years before.
As you know, your gastrointestinal tract is the first thing that will be disturbed when you have a mental problem. And definitely that is one of the first thing that you have to consider. And then if you have a gastrointestinal problem, definitely there will be a mental problem, not the physical causes, just like taking chicken or taking non-vegetarian diet or something like that. But that comes secondary. But if there is a constant problem, then it is not the diet, but it may be the hidden thing in her mind.
Yes, yes. Yes, okay. Yeah.
Yeah.
Dr. Sergi, are you there? Please unmute. Sergi from Turkey. Yes. Yeah. Please.
Hi. Thank you, Dr. Dhanesh. Very, very wonderful case. I'm happy seeing all of this case. It is very difficult patients, cancer patients, is the treatment is multi-system problems. And we treat it in not just the cancer, at the same time in subconscious level, stress, and other changes, we must treat them. And problem, all the medicine and operation, and most of them chemotherapy and others. And we have a lot of problems because at the same time we didn't give homeopathic treatment.
We used to get patients after this chemotherapy and all those radiation therapy and all those. And in those cases also we can manage with our homeopathic medicine in the later part. So it does not mean that you cannot treat a patient who are coming out from this chemotherapy or the other kind of treatment, radiation or something like that. But we can treat from when a patient when we get a patient from any whether it is in the beginning or in the end part, whether it doesn't matter much, but what matters is the patient.
Yes, yes, I believe that.
Yes.
I think Dr.
Side effects of chemotherapy and after.
Sorry. Ambadi can add something more here.
Wait.
Treatment.
Dr. Sergi, okay, it's over.
Thank you so much.
Okay, yes, thank you for your participation. You must continue to participate in our daily program. Okay, thank you. Dr. Ramadevi Ambadi, please, yes.
See, we can start the treatment of cancer of breast. We could not give carcinosin, but we can start the treatment by giving 1 dose of serenum. Only 1 dose. We can start the treatment. And if the pain is burning type, we can give Ifph 30 TDS. And if the burning pain is ameliorated by warm application, we can give arsenic alb. Okay, then recurrent attack at repeated abscess, cancer due to repeated abscess, we can give graphitis 30 TDS. Then for young persons, we can give bromium. But here we should look the face. If the face seems looks older, like a brotanum, we can give bromium 30 TDS. It will give relief. Then occult cancer, that means hidden. We will be getting it will be diagnosed in the 2nd or 3rd stage. In that case, we can give Bufo. Here we can give it as a palliative also. In 3rd stage and 4th stage, we cannot do anything, no. In that stage, we can give palliative as palliative also. Here, tarantulas, cubans also can be given as palliative medicine. Tarantula, I used to give 200 potency. Then Huang Nang tincture that remove the fetid odor of this breast cancer. As well as that hydrosis tincture also can be given in the initial stage. Then arsenic iodide 3x, cancer of breast after ulceration has started. If the ulceration is not yet started, we can give hydrosis tincture. Then Asperger's Rubens also can be given in the ulcerative stage, 30. That is, these are our, I used to give.
Yes. Suggestions. Now we can invite Dr. Ismail sir. Sir, please. Sir, are you there?
Actually, I came very late. I don't listen to everything. But anyway, matter is cancer, no? Matter is cancer.
Yes, sir.
So, yeah. So I will give a watermelon. That means a single medicine for relieve the pain. The cancer is, the pain is very tolerable, no? Nobody can tolerate the pain anywhere it comes. Pain medicines, so many medicines we have. But in my experience, since last 40 years, I'm practicing with calculated carb 30 only. 1 hourly. That means I'm mixing one drop into the half ounce of water, half glass of water, give it 1 teaspoonful every hourly. First day itself, the pain will relieve. The next day, the pain will relieve. Then we can start to once in 2 hours, then 3 hours and 4th hourly. After 5 days, we can stop the medicine also, then painkiller. Other medicines we can give according to the symptomatology and other constitution, taking the constitution of the medicines or mathematics. So to prevent the cancer, so somebody is born in the cancer patient family, so there we can give carbo animalis or graphite high potency once in 2 months only. So they will prevent from the cancer.
Yes.
Sir, what is your experience with treating this breast cancer, sir? What about breast cancer?
Breast cancer, we have a lot of so medicines. We are having a lot of medicines. Breast cancer. The breast cancer, suppose you go to the lung parenchyma, you can give the arsenic album, not 3x, 4x. Why I am not prescribing 3x? Suppose we are giving the lot of medicine, no? The 3x will give it continuously 3 times daily or twice daily like that. So it will produce some skin complaints, some allergy. Thickening of the skin will happen. So that will irritate the patient and they will get itchy. So suppose they are not giving the 3x, 4x switch on, nothing will happen.
Okay.
Thank you, sir, very much.
Yes. Dr. Hubert, this will raise the hand. Dr. Hubert, please. Yes. Unmute. Dr. Hubert, please unmute. Yes. Okay.
Doctor, can you hear me?
Yes, yes.
If the symptoms are over, I am asking to Dr. said, sir, can we stop the medicine? Can we stop the medicine at any time?
Which one? How?
If the complaints are okay, if no complaints are there, the symptoms are almost okay. Shall we have to continue the medicine or we can stop the medicine at any time?
We can stop the medicine, but tapering only. Suppose we are giving the medicine twice daily, go to 1 dose per day or once in 2 days. Then with the consistent medicine, we conclude. We find out the very consistent medicine or mathematical medicine. That medicine you administer and we can come conclusion.
Okay.
Thank you, sir. Thank you, sir.
It's the time to wind up the session. I am inviting Dr. Padam to say the word of thanks. Padam, sir, please.
Thank you, Doctor, for the chance given to comment and present vote of thanks to the great presentation of Dr. Dhanesh. It was a wonderful presentation with illustration of cases that are cured. As it is to be noted, a cancer case can be psychotic or syphilitic in nature, according to the case. In some cases, soric also. Usually, I treat with anti-miasmatic medicines. And as Dr. Ramadevi Ambadi has commented, it has given me very good result with Cernum.
Yes.
Other medicines also work very well.
Okay, sir. Okay.
Then the presentation was very, very nice. And I would like to thank Dr. Dhanesh for his wonderful presentation. in this venue. And I would like to thank him on behalf of IFPH and myself. Thank you, Doctor. Thank you.
Well, that's the end of the 466th day of continuous Zooms and IFPH. It's the time to wind up the session. Today we'll be back again with another topic in English. Now it's to our Malayalam session. So up to you, Dr. Hubert De Silva. Yes.
Thank you very much, Dr. Manoj. I'm very much thankful to Dr. Dhanesh, who took this challenge. He always takes challenges. Now he's today we know that how much he is suffering for to maintain the situation in our IFPS conditions, always seeking doctors for the platform and doing everything. Thank you very much, Dr. Dhanesh. In addition to that, you are doing these wonderful things and sharing your experiences with us is also very much thankful to you. Thank you.